and Deepal. 20 minutes from now, we can go live. From now, like 20 seconds from now, we can go live.
Sure.
Yeah, I'll be on mute.
Welcome and good afternoon, viewers, to this very interesting conversation today on the journey towards motherhood. In the run-up to the Mother's Day celebrations, we at the Times of India, in association with veteran obstetricians and gynecologists from the Kamineni hospitals, bring to you essential pointers to ensure a safe and healthy pregnancy and childbirth. We are calling it the new parenthood, not because parenting is new, but because the situations in which young mothers find themselves today are different from a lot of the situations our earlier generations faced. Therefore, we do need much more insights and direct advice from the doctors to ensure that we actually are able to take this journey well. When we lived in large families, there was always someone to advise a young mother and take care of her. Today in large metros especially, chances that the expecting mother may be working for the first few months with their careers, and also probably living in a nuclear family are more likely. So there is a need to empower the young mothers with clear, verified information, which is coming from experience, which is exactly what we have today with our panelists. Motherhood is one of the great joys of life. How do we keep this journey safe, natural, joyous, predictable? It will be the heart of the conversation today, viewers. Before I begin, I would like to remind you that you can send in your questions, as you have this rare opportunity to take direct advice from this panel, which has very senior doctors. Let's meet them right away. We have with us Dr. K. Vasundhara, who is a very renowned academician and also obstetrician and gynecology head of the Kamineni hospitals. She is the professor and head of department at the Kamineni Academy of Medical Sciences and Research Center. We have with us Dr. Prasanna Lata, who is the associate professor at the Kamineni Academy of Medical Sciences and Research Center, and also a consultant obstetrician and gynecologist. And finally, we have with us Mrs. N. Lakshmi, who is the chief dietitian of the Kamineni hospitals. Welcome all of you. And we really look forward to a very interesting and detailed conversation emanating from your experience. So to begin with, a woman today is juggling many responsibilities and activities, and time can go by in achieving goals. But one has to ask, fundamentally, what is the best time to think of motherhood once you get married? So, Dr. Vasundhara, what is the ideal time? Is there a time band in which you think a woman should, try and have her children? And what happens if pregnancies get delayed? Like if you, delayed beyond the age of 35 and things like that. That would be a great place to start.
All right. Thank you, Deepal. All of us within our bodies, we have a clock called the biological clock, and it ticks away. Yeah. Whether we like it or we don't like it, the clock ticks away. So everything is pre-programmed in our body. So we can't postpone things, or we shouldn't prepone things also. So giving thoughts to the present generation, their lifestyle, their education, their jobs, I feel that a band of 25 to 30 years of age is a very good time to have a child. Because what we are seeing in our practice is people who have children very early in life, in their early 20s and in the late teens, like 19 to 20, 21, 22, they have a lot of problems. And also women who have babies in their 30s, especially late 30s, have again severe problems. All the lifestyle diseases start catching up with you, like diabetes and hypertension And if you have any problems like polycystic ovary disease, PCOD, you must have heard about that word. So that also becomes worse and worse as the time goes on. So it's not that these diseases were not there a couple of decades ago or a generation ago. The diseases were there. But because people are having loads of children within the right time, they did not have, the children, the pregnancies did not have to face these lifestyle diseases during that time. So I suggest a particular band between 25 and 30, finish having your 2 children by that time.
Yeah, that is great advice, and it really helps a woman to plan for life. You know, if she knows that, yeah, this is the time band in which I should have my children. Yeah. But just planning to have a baby, you know, we would really like to discuss what is the role of nutrition. For example, what kind of nutrition should be taken even while you're planning to have a baby, and then during pregnancy. And, you know, what is the impact that you have seen of a high quality diet on children, and maybe also the negative impact, if you are saying, of a low quality diet, and maybe, you know, having too many medicines, not advised well during pregnancy. Mrs. Lakshmi, this question would be best answered by you.
So prior to plan any pregnancy, the underlying conditions like PCOD, obesity, or any diabetes, underlying condition should be corrected. So a well-designed nutrition plan will have a greater impact on the outcome. So it should be a customized plan pre-pregnancy according to their condition, and we plan. And accordingly, if they follow, all the nutritional deficiencies as far as possible can be controlled. Like suppose folic acid deficiency is very common. So by taking lot of green leaf vegetables, nuts, everything, so the folic acid deficiency can be corrected. So by taking proper diet, many of the nutritional deficiency can be corrected. So a well-designed plan will help a lot to the outcome, proper outcome. So it has
yes.
And by taking proper food groups from different sources like protein sources, folic acid sources, and high fiber and low glycemic foods, everything in a balanced formula, if we take by correcting deficiencies as well, it will have a greater impact on the outcome.
Sure. And would you like to add from your experience what you have seen with women who have taken great care of their diet through pregnancies, the outcome, the impact on the baby, and if they have not taken?
Yeah. We see many of them are anemic. So it should be corrected before only, then they will not have any problem. So
okay.
So they should take a lot of like green, all the sources from high protein sources, green leaf vegetables, from all the food groups. If they take, it is better.
Sure. Thank you for that, Ms. Lakshmi. Dr. Vasundhara, the next question is about a topic which has been discussed a lot, not just in homes, but even with policymakers, with the health departments in the government, because it impacts human life deeply, and it is a reflection of how we have changed our lifestyle. I'm talking about C-sections and the increasing rate of C-sections. There's a lot of concern over this trend, ma'am. And why do you think women have moved away from the natural birthing process? Because it's not always the doctor. Sometimes it's the patients who say, I want to have a C-section delivery. And frankly, is it safe to do this, to take your own call like that?
Yeah. Cesarean section, the decision to perform a cesarean section or the requirement of cesarean section should be left to the obstetricians in consultation with the patient.
Yeah.
Okay. And there should be a very good preparation of the woman even before delivery, that about the birthing process, how the birthing process occurs, what all she is going to experience, and what help will be given by the doctors, the midwife, and the anesthetist during the labor process.
Yes.
And that's how we prepare the girl for a delivery.
Yeah.
And if she's not prepared, she's not going to cooperate. and she's not going to be very helpful in conducting a normal delivery. Normal vaginal delivery is a normal physiological process.
Yeah.
And if we are doing a cesarean section for no reason at all, and that is one of the reasons of high cesarean section rates. Cesarean section, which is done at what is called as a maternal request, when there is no gynecological obstetrical indication for cesarean section. Now, if people go to purohits or others and get a auspicious time,
yes,
and have designer babies born at a designer time, hoping that the babies will have all the qualities of, say, some big short film star or some cricketer or some actor or something, because they were born on that day at that time. It doesn't happen like that.
Yeah.
So,
in fact,
it's cesarean section, all said and done, is a major surgery.
Yeah.
It should be done only when it is necessary. Now, there's a great debate going on in our state of Telangana between the government of Telangana and the gynecologists all over Telangana, right from Adilabad to Nalgonda, that we are having very high cesarean section rates. And this is being pointed out to us by a lot of international agencies.
Yes.
It's not healthy. There is a certain healthy rate of cesarean sections when you can prevent the harm coming to the baby or the mother or both. But we are having an unnatural, very high cesarean section rates in our state. So obviously cesarean sections are being done not for obstetrical reasons. And we are interfering with nature. It's not a tooth extraction or something as trivial as that. So cesarean sections are being trivialized and being done on demand.
Yeah.
And
which is absolutely not, not in order of, I mean, first of all, there has to be a respect for nature. Nature will take its own time, and the baby will come in at a natural time. And this session, like you're saying, with the astrologer saying this is a good time, that's a good time, this is a good day, can do more damage than good.
All said and done, cesarean section is a major surgery. Every major surgery is going to harm the body. Although it is done to save, sometimes to save the mother or the baby or both. But if it is going to happen unnecessarily, just imagine if your dentist pulls out your normal tooth, will it be harmful or not?
Of course it will be.
I mean, this is just a simile I'm giving. It doesn't mean it's as trivial as that. But please don't trivialize. Let us go with nature, not against it. Let the woman go into labor. Let her start her labor pains naturally. Let her go with the labor pains. And if necessary, during the process of labor, she is not progressing, the baby is not coming down, the baby feels stuck, then we do a cesarean section. So, to tell you the truth, the reasons for high cesarean sections are both from the woman and from the doctor's side. Doctors are single-handed doctors in many of the hospitals. They do not have any assistance. They do not have assistants, or they do not have anesthetists who are there at their beck and call at any time of the day and night. So they do it whenever it is convenient for them. So this is what happens. There are many reasons for it, and we have to accept that in Telangana, we have a very high unnatural rate of cesarean sections.
Thank you for all those insights, Dr. Vasundhara. I think, anyone having a baby will be alerted that C-section is absolutely the last resort. That too, it has to be taken with absolute consultation with the doctors.
Yes.
And not at all a healthy solution to take prior just to have the baby in 20 minutes instead of the 12-14 hour period which nature takes, the whole processing of childbirth. So thank you. I think that's a very, very vital point.
If I can add something here.
Yes.
See, normal childbirth is a gradual process.
Yes.
Especially in a first timer, it can go up to 16 to 18 hours.
Yes.
So the body gets adjusted to a childbirth.
Slowly.
Yeah. If you do a sudden cesarean section for no reason at all, the body, mind, and the soul are not ready. Sometimes The mothers can go into some different problems, psychological problems, depressions and whatnot with the baby. There are instances of mothers not accepting the babies, not giving breastfeeding to the babies. And we have had so many problems when mothers really go into a real problem called postpartum depression.
Yes.
I think it happens more with cesarean section babies than with cesarean section mothers than with normal vaginal delivery mothers. Because the body, mind, and the soul of the patient or the woman who is delivering doesn't have the time to adjust to the labor process. You know, suddenly you are giving her something which maybe she was not prepared.
Absolutely, Dr. Vasundhara. I've heard of postpartum depression.
Yes.
And yes, it's not something to be taken lightly.
It's quite real. Yeah.
Absolutely. The other question and discussion and conversation that happens a lot is about the ART technique, the artificial reproductive techniques, which women would resort to if they are not able to conceive naturally. Then when the trend started, there was a lot of question about, is it even ethical? Is it right? It's become common now. A lot of doctors feel that at least a woman has a chance to have a baby this way. Dr. Vasundhara, could you just also throw some light on how safe it is? How much has this advanced technologically? And, when would you recommend that a woman goes towards ART?
Okay. Yeah. When a husband and wife are living together, not using any contraception for 1 year, then I think they need to go in for investigations and management of what is called as difficulty to conceive. We don't call it infertility. Infertility is an absolute term, total inability to have a child, which is not true. So they should go in for what is the difficulty in conceiving. And the ART techniques, or what is commonly called as test tube baby, may not be necessary for everybody. I always tell my patient, it's like the last rung of the ladder. Do we climb the last rung of the ladder suddenly? No. We go from the bottom of the rung, bottom of the ladder, and keep climbing one step at a time. So if there is a staircase, one doesn't go to the top of the staircase immediately, right? It's just like the same thing. That's the last point. Yes, it's available, but a couple may be helped by smaller techniques.
Absolutely.
Little help. Yeah. Little help like monitoring their hormones or monitoring the sperm count of the man, or giving some small support in the form of superovulation, intrauterine insemination. There are smaller techniques. But yes, if someone doesn't conceive and they want to conceive and they're not able to conceive after 1 year of togetherness without a contraception, then they need to see a doctor. That's a must. We can't go on forever and ever and say, no, it will happen sometime or the other. Yeah. 1 year is the cutoff time.
That's a good way to look at it. And we must look at, like you say, you have to go through the steps of the ladder.
Yeah.
Try a natural conception first, and only then think of the other smaller help. And if absolutely nothing works, then you move towards ART. Yes. Ms. Lakshmi, could you tell us what are the things that you've seen that have a negative impact? For example, habits like smoking or other habits, lifestyle habits, which could have a negative impact in pregnancy. So therefore, we must definitely stop them for the period of the pregnancy and a few months before, if we cannot stop it permanently right through life.
Yeah, one is, as you said, it is smoking and even alcohol. And few people are taking drugs as well. So they should stop all those things. And you have a lot of taking caffeinated products. So all those things should be stopped. And they should take a proper balanced diet, so that they can have all the nutrients, and it is better for them to have a preparedness for the child. Okay, so free from the deficiencies and all the nutrients, and it's they will have a better outcome.
Okay. So one must definitely keep a watch on habits, which one may have developed over time.
Surely it will have an impact on that, on the nutritional status.
Yes, yes.
And nowadays, lot of like people take carbonated drinks, even it has and sugary products,
Yes.
and like refined foods. And as we had seen in many cases, like they're lacking fiber, so most of them are constipated. So all these things should be corrected.
Yeah, absolutely. Especially the drinking a lot of sugary drink. Almost everything has a very high level of sugar. Of course, yeah. Thank you for that. Other than food and in dietary intake, there is also the mental and emotional condition of a mother, and which has an impact. And in fact, even in our ancient scriptures, there is so much advice on how the mother should, take care of herself in terms of, how she should, what kind of thoughts she should think to that detail, so that it helps the baby. I think all these things put together create a very conducive environment for the child. Dr. Vasundhara, would you like to give your inputs? And Dr. Prasanna also, would you like to give your inputs on these aspects? Just the mental health of a mother, the mental and emotional balance of a mother, and right through pregnancy.
Yeah, the mother has to maintain her mental and emotional balance should be proper for her to conceive. Like in ancient days also, they used to ask pregnant women to listen to soft music, to be happy during when she is planning to conceive. And also the family support used to be very good in the ancient times. But now with the nuclear families, they have a lot of stress. And women who are career oriented, they take a lot of stress actually. Their career, their developments, and maybe the planning of the pregnancy, maybe it may fall in a wrong time, and like when they are expecting a promotion or something, and that stress also can lead to, like, they're more prone to abortions also, or they're more prone to few conditions like hypertension in pregnancy or diabetes in pregnancy. Stress increases the risk for all these conditions. Actually, they have conducted a study called as Happy Study in Netherlands. That is a holistic approach towards pregnancy and the first postpartum week. And they have seen that women who are more stressed, they have higher levels of this thyroid hormone imbalance and higher levels of beta HCG, where they are more prone to hyperemesis, and they are more prone to conditions where even the neurological development of the fetus could get affected. So the child's neurological development, psychological development gets affected in the first 1 year or 2 years of life. So if they can maintain a balance between their emotional and their mental status, I think they can have a better pregnancy outcome.
Yes, absolutely. Thank you. Those are very vital input. And I think if we are in a very high stress environment, and say maybe in a career, maybe we should think of another option for some time, because time, and you do need an environment to bring in a new life into the family. You do need an environment of some kind to bring in a new life into the family. Also, that, like you mentioned, lifestyle diseases are becoming common at a younger and younger age. We have mothers who have diabetes or high tension, high pressure. And do you suggest that they also take some extra care during the pregnancy?
They definitely need, even the pre-pregnancy period also, they definitely need, like most of the women nowadays, we are seeing sedentary lifestyles. Like they sit before the computer for long periods of time, their working hours are like that, long periods of hours. So the sedentary lifestyle also, it leads to many problems like obesity. So whenever the body mass index is more, which we call it as obesity, so in these conditions, they are more prone they conceive, their conception can get affected first thing. And even if they conceive, because the pregnancy is a condition where they put on more weight. So they are more prone to gestational diabetes, and they are more prone to gestational hypertension. And obesity itself in pregnancy can lead to disorders like where the blood can clot in their legs, like we call it as venous thrombosis. So all these conditions can increase, and then they are more prone to these problems in pregnancies. So it's better they maintain a very healthy lifestyle. So we should encourage these women to exercise, and actually we recommend at least 150 minutes of exercise in a week for pregnant women, and that is, it comes to around 30 minutes a day. So they can do this regular exercise. We can motivate them, like we can motivate pregnant women for exercising through 5 ways, which we generally do. Like we ask them, we advise them, we assist, and then arrange things in such a way so that whatever exercises are possible by the pregnant woman, we can teach them. With the help of a physiotherapist, we can ask them to maintain a healthy lifestyle and a proper diet so that their pregnancy period will be smooth.
Yes, absolutely. In fact, in the villages of India, I know that in the farming communities, women work right up to the end. I mean, till they are about to deliver. So the physical activity is not reducing at all, even through the pregnancy. And it is just considered another natural aspect of life. Sometimes I feel, and I would like to hear Dr. Vasundhara's view on this, that because we had more family support, we could see pregnancy as just a natural aspect of life. What is the role of the family in bringing about, a really healthy pregnancy in a woman? What should the family do to ensure that a woman has the best environment at home, Dr. Vasundhara? From all your experience, I'm sure you have some great insights into that.
Well, family has a huge role to play in welcoming a new member into its fold, isn't it? By having a pregnancy and a new childbirth, the family is going to increase. As we all know that young mothers, young pregnant women need a lot of emotional support. And as Dr. Prasanna said, women who do not have emotional support tend to show problems like hyperemesis gravidarum. When in that condition, they have excessive vomiting, they lose a lot of the electrolytes, and they are to be hospitalized, and they have to be given intravenous fluids. So it can become so bad. So it's a very small thing. So by giving them, remember in olden days, every young pregnant woman was to be fussed upon. Yeah. And now we live in nuclear families, we live a very isolated life with no one to fuss upon us. Yeah. And the husband is busy in his own work and thinking about his targets and his this and that and his deadlines and all. And where he doesn't have the time to fuss over them. So I think it is, and the women deserve every bit of fussing over during those 9 months. But at the same time, let me warn you that fussing over doesn't mean constant feeding them high calorie foods or sweets and mithais and things made of maida, refined flour and things like that. Yeah, they can be encouraged to eat more fruit or eat a variety of vegetables or eat a variety of food in the dinner table, and someone can take them for a walk for 20 minutes in the morning or 20 minutes in the evening. I always tell my patients never to go alone on a walk. There have been instances when women have had a syncopal attack and fallen down and there was no one with them. So going for a walk doesn't mean you go all alone. Take some family member with you. Yeah, and constant encouragement and constant reassurance from some other family member that everything is going to be all right. It's just a physiological thing. We've all had babies. I've had 4. If the mother-in-law tells her, I've had 6 babies and it's nothing to worry. It's so reassuring for a woman. So that should again be brought back. And if we are not able to do in person, if the mother-in-law is not able to go to that place or to the house in person, we should be doing it on a Zoom platform or some WhatsApp chat or something like that.
Use technology, yes.
Use technology and pamper the girl and reassure her and make her develop a positive attitude towards pregnancy and delivery, that yes, everything is going to be all right. I'm going to be fine. I'm going to have a nice, lovely baby in my hands at the end of my delivery and labor, and we are going to be very happy.
Yes.
So that should be the attitude.
That's very well said, and it is genuinely the reassurance of the family members is what will keep that young mother in place emotionally through the journey.
Yeah. See, in a nuclear family, the husband is sitting in front of the girl and eating a big burger or some Big Mac or whatever big things. right in front of the woman, or sitting and eating pastries and desserts and all. These are not to be eaten by a pregnant woman.
Yeah.
Highly refined foods such as those which I mentioned are not to be eaten. Well, if she wants, she can have a roti extra or a cup of rice extra with some extra vegetables or extra dal or extra dahi or extra paneer, but not having a piece of a chocolate cake or some brownie or with some tomato with sugary sauce on it. No, that's not to be done. So if the husband nowadays in nuclear family, just the both of them, if the husband also avoids all these for a few months, it's not going to do any harm to him.
Oh, yes.
It's going to be all benefits to the mother. So
Absolutely.
in that way, even he has to sacrifice, isn't it? Or we don't cook such things at home. Don't bring such things. Don't order on all those food aggregators, Swiggy, Zomato, blah, 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 blah. Yeah, don't do that. Otherwise, what's the point? She's going to feel all the more worse.
Yes.
Just because I'm pregnant, I'm not allowed to eat all that, and she's going to go into a depression.
Yes, absolutely.
It's not acceptable. These are small things. Come early from the office, take her for a walk in the evening. In the morning, after breakfast, take her for a walk for 20 minutes. Go 10 minutes each way, 10 minutes, come back. That's a beautiful way. And do it twice a day. Morning 20 minutes, evening 20 minutes. You're walking for 40 minutes. It is very, very significant, very, very good. And all the patients, all the women who come to me right from the beginning, say their 4th month, this is the advice I give right from the beginning so that they don't develop diabetes at all. If you're hungry, eat a fruit more. If you're hungry, eat a chapati more. Eat a cup of rice more, doesn't matter. But don't eat all these sugary things. Yes. And Indian cuisine is full of all those things. Yeah, gulab jams and blah, blah. People coming to your house and bringing sweets along with you.
Yes, that's true.
You don't make things, you don't buy them, but people come home and give all those things. You're tempted to eat.
They should bring fruits instead of sweets, they can bring fruits.
Yes, and stop drinking Cokes along with your dinner, just like the Westerners.
Oh, yeah.
They are not, have just plain water, not Coke or whatever people are drinking nowadays along with their food. I've seen nowadays a new trend has come. People don't drink plain water. It's considered infradig, if you had drink plain water.
Yeah.
Yeah, you have to have Coke or whatever, Thumbs Up or whatever, 7-Up or whatever with your Sprite. The Sprite, so all these are full of sugar, aerated drinks.
Oh, yes. But buttermilk should be okay, I suppose, Dr. Vasundhara?
Yeah, buttermilk can be taken.
Lakshmi.
They do more damage to the GI tract. So all those should be avoided. Like buttermilk or any porridges, soups can be taken.
But buttermilk without sugar, don't add sugar to buttermilk.
Not lassi. Not lassi.
Plain buttermilk.
Yes. No, I think it's a big boon to have a healthy baby, and for a baby who has any problems right from the beginning, first of all, the parents will feel very guilty, and secondly, it's so much more effort to bring up the child. So these small things, these things are small compared to the problems that can happen in the future. So I'm sure parents can take care of these things and just stay aligned with what works for the body and works for the new life that you're bringing into the world. Yeah. So, the other question other than, this food and activity and all these things is the whole process of management of a pregnancy. Like, for example, a lot of young mothers are constantly screening, testing. So sometimes more senior women wonder, is this necessary? Like, you have to constantly keep screening, even if the mother is healthy. And what kind of tests and what kind of frequency do you recommend, doctor, for mothers who are normal? And then when should they start? When do the red flags come up? Like, to feel, okay, no, this particular patient needs extra care, extra attention, extra screening, extra testing, so that we are sure she is on track. So, Dr. Vasundhara, if you could answer, and then Dr. Prasanna.
Yeah, there's a whole program called the antenatal care, which starts right from the time of confirmation of pregnancy. The woman comes to the hospital, the pregnancy is confirmed again. She does a urine pregnancy test at home, but also where you confirm it in the hospital, do a booking scan, and then there's a small battery of tests. And the word, I did not like the word constant. No, the constant tests are not done. I do agree with you that there are doctors who order for tests. I'm sure if my colleagues, Dr. Prasanna also agrees on that. Doctors order tests at every visit, whether required or not. I think in the first 7 months, a few tests at every visit is at once in a month is enough. And when you do the first screening, which is called as an antenatal profile, in that you come to know about the general health of the mother. And as you said, if you think we are suspecting she's going into diabetes, she's going into hypertension, then we start controlling and treating the problem right there. But pregnancy is not a disease. Don't medicalize pregnancy.
Yes,
Yeah?
absolutely.
It's at the end of the day a physiological process.
Yes.
So constant battery of tests being done like some grave disease, that's not necessary. And what I see is that instead of simple things like checking the weight of the mother, how much she has put on, or checking the blood pressure of the woman, people are ordering for all exotic tests.
Yeah.
3D scans and 4D scans and whatnot. Yeah. And the women expect you to give them a video of their baby scans along with his heart rate recording sounds, audio clip. Yeah, that is more exotic and that's more exciting for the women. What is required is a simple check of the mother's weight every visit, a simple blood pressure, a simple hemoglobin, a urine test for albumin and sugar. These are most important things, and what we see generally in patients who come with severe problems is that all these have been missed. And they've had a battery of scans and a battery of all those fancy tests. They've spent thousands of rupees till then. Yes. So constant tests do not mean that we do not require unnecessary tests. There are some necessary tests which have to be done every month, up to 7 months, every month. And then we can scatter them later. But everybody wants to, at every visit, just because you have a scanning machine right next to your consultation chair, it doesn't mean you subject a woman to a scan every time she comes to. Yeah. You have your clinical techniques. We have a clinical technique of examination of pregnant women. Yeah. And this is the reason that doctors are losing their clinical skills.
Yes.
Yeah. We seem to be ordering more than looking at the patient, feeling the patient with our own hands and treating them.
Yes.
And also, instead of looking at a patient, interacting with them, examining them, and then treating them, we
Yes.
seem to be treating the tests rather than the patients.
Yes.
Yeah. So that all unhealthy trend is going on. Patients also say, oh, she didn't do anything, no tests were done, she just gave me some simple medicines. Yeah. This also holds good for about medicines. There are some patients who expect you to give fancy medicines every time they come, and a big list of those fancy medicines. They are happy when you give them a whole list of medicines, some injections, some syrups, some tablets, some capsules. Arey, why all this? It's not required.
Yeah.
Right? When some women are pregnant for the first time in their lives, and they are given medicines to prevent abortions. Why? Mm-hmm. Why give medicines for prevention of abortions, miscarriage? So these kind of things happen. It's not required. Pregnancy is let us cross the bridge when we come to the river.
Yeah.
Why think of the bridge and the river right from the beginning and keep on crossing them, imaginary bridges?
Yeah.
Yeah.
Yeah. And adding to them, very, very important points. Very important to look at pregnancy, like you said, as a natural phenomena, and leave things to nature and only intervene when required.
Like many a times we have seen that they get a battery of investigations done, but simple anemia being missed. Anemia not being treated. They come to us at 8th month, 9th month, their hemoglobin falls from 11 to 8, and then they come to us at the end. So meanwhile, they might have got done many number of investigations, n number of scans, and all that, but simple anemia not being treated. So clinicians have to, like, I feel that they should look into the reports and then treat the patients also properly. Like advise them properly regarding iron supplementation, because women think in pregnancy they have their own problems, like they are a little fussy, they may not like to take more number of tablets. The tablet size also matters in few women. So repeated counseling and encouraging them to take the iron supplements is very, very important, at least in India, because most of the women in India are anemic.
Anemic public.
Yeah.
Yeah. Yes. Also that indiscriminate medicine also can have an impact on the fetus. I personally know of people who were born with skin problems and all that, just because the mother had, taken in some medicines which didn't suit the body at all. So I think this is an important point. While of course doctors have a lot of experience, they know what they're doing, but they are also human beings. They can also sometimes make a mistake in recommending medicine. Sometimes people just take medicines on their own without even consulting a doctor. So taking medicine in the normal course of life is one thing, but taking medicines for whatever reason during pregnancy obviously has a direct impact on the fetus.
Yeah.
So would you like to just, highlight that aspect as well? Dr. Vasundhara.
Yeah, sure. If you talk about indiscriminate medicine,
yeah,
it could be even a small dose of things like medicines for headache. Yeah, I feel paracetamol is the most safest medicine for headache. Headaches are very common even in early pregnancy. But if you pump a woman with too much of aspirin, or she takes a variety of painkillers without asking anyone, self-medication, that is bad. Or she goes to a general practitioner, doesn't reveal that she is pregnant, and he gives her medicines which are not to be taken in pregnancy. There has been a worldwide disaster of a drug called thalidomide. In the 40s and 50s, there was a drug called thalidomide, which was given for excessive vomitings in pregnancy. And these patients, poor things, they developed seal-like limbs, small seal-like limbs, all the four. They were not able to walk, they were not able to sit, they were not able to use their limbs. So that was a big disaster all over the world that happened. Yeah, that's called the thalidomide disaster. But poor things, the doctors didn't know that thalidomide causes this, and they have given that. So there are such evidences in the world where medicines can cause problems. So girls who have epilepsy, fits in before their marriage. Yeah, I'll give you a small example. I've seen many patients with epilepsy. They have epilepsy. They do not want to reveal to the in-laws that they have epilepsy. They are taking some medicine. Yeah, they fall pregnant after their marriage, and they do not reveal to anybody that they are taking these drugs. And these drugs act against folic acid in the body. They are absolutely necessary for a woman in pregnancy, for epileptic women. And they act against the folic acid present in the body, and they cause terrible changes in the babies. There are syndromes called fetal hydantoin syndrome and things like that, when the drug phenytoin can cause. Yeah, they're very well known. Even simple alcohol can cause a fetal alcohol syndrome. There's a typical face of a child born to a mother who takes unlimited alcohol in pregnancy. Yeah, and in the cities we see women who are pregnant, early pregnancy, they go to, pub hopping. There's something called new thing called pub hopping. Yeah, you don't stop with one pub or with one peg of your drink. Yeah, you go to different pubs and try to savor the different drinks which are available in different pubs. It's terribly harmful. It can cause a syndrome called fetal alcohol syndrome, when the facial features of the child get distorted. Yeah, it can have a permanent impact on the child. as I said. Then people who take high blood pressure medications, women who take medications for diabetes, although many of them are safe, but some of them are not safe in pregnancy, and they have to change over to medications which are safe in pregnancy. Like insulin is very safe in pregnancy. The metformin has been found to be safe in pregnancy. So they have to change from those those drugs to safer drugs in pregnancy. Yeah. So, but I tell all my young mothers, please do not take any medication without supervision.
Yeah.
Without calling us. We have a 24/7 helpline, which number is available to all my patients all the time. And definitely a doctor will answer the call any time of the day and night. There is a call available and the phone is never switched off. 24/7 it's available. They can call us anytime. Just say, I need this, can I take this medicine? And if she's able to come over to the hospital, we examine the woman and give her a prescription of the medicine. So please do not take non-prescription drugs. Even paracetamol can be harmful. Let me give a very funny example. A woman took too much of vitamin A and vitamin D in early pregnancy, so that the child will be strong, boned and tall and hefty, I believe. That damaged the child's neurological system.
Oh my.
So excess of vitamins also can damage you in the early pregnancy.
I'm sure very few people know that. Yeah.
That should not be taken. Whatever the body doesn't require is poison.
Yeah.
Yeah. So
whatever the body doesn't require is poison. That's a line to remember. Yeah. Yeah. And the fetus is so sensitive. It will react to every single thing that is going into the body, without doubt. Yes. Thank you. That was very eye-opening, Dr. Vasundhara. Dr. Prasanna, the one thing that we have seen in India's culture and tradition is that, young women would be encouraged to take up arts, like maybe singing. It could be spiritual singing or any other kind of singing, painting, any kind of holistic activities, because they say that all that has an impact on the child which is coming. To create an environment within the body and the mind of the patient which is happy, which is creative, so that the child gets to experience some of that while the fetus is still growing. Then there are so many traditions in India like that. I'm sure you know of all of them. Which do you think are particularly valuable today for a young mother? Like, which would you say definitely should be a part of a young mother's life? A conceiving mother, yes.
Indian culture, actually in Vedas and Puranas also, they have described, like they've asked women to maintain, to develop an art like painting, or they can even do singing, or a simple thing like planting trees. Because when you plant a tree and it grows, and she is pregnant, her child also grows like that only in a healthy environment, like healthy. So I do encourage all these things. Few are very good, like simple baby shower. It's a simple tradition where the woman will feel delighted, she'll feel happy, because people will come to her and then bless her, and she can talk to people, express her feelings. Like nowadays we are seeing nuclear families. So when they do a baby shower, maybe she can meet many of the people, her grandparents, her parents, and actually I feel in a way grandparents are better than the parents, because they encourage us to lead a healthy lifestyle. Like most of the women are overfed and they have a sedentary lifestyle, and we see women not setting into labor even in their when they come to 40 weeks of pregnancy, because we expect women to develop labor pains by 38, 39 weeks. Naturally, the labor pains start. But nowadays, we are seeing, because of the sedentary lifestyles and overeating, and the babies becoming bigger in size, macrosomic babies, the delivery is becoming difficult. Like when you see the grandparents, they usually ask us to walk a lot, to squat in the last few weeks of the pregnancy. That helps in a normal vaginal delivery. So it helps you to enter into a process of the head getting fixed into the pelvis, coming down, and then helping you to have a vaginal delivery. So few traditions, Indian traditions, are really good.
Yes.
So I would like to encourage women, especially in their last weeks, not to eat more also. Most of our grandparents, they ask us not to eat more during the last trimester. Even because that helps in a way, because the baby will not become macrosomic. Because the baby starts putting on weight in the last weeks.
Last.
Yeah, it puts the fat.
Puts on fat.
Yeah, it's not good.
Yeah.
I also advise the women not to watch violent movies.
Yes.
And violent movies with a lot of violence seem to become big hits. They are the only ones available now. Yeah. So please don't watch all those violent movies. They're not going to help. And as we all know, Abhimanyu, the son of Arjuna, in the Mahabharata, Abhimanyu learned the art of war, how to get into the formation called Chakravyuha during the Mahabharata war. When Lord Krishna was telling the same to his mother, to Abhimanyu's mother, Subhadra. And Abhimanyu heard that when he was in the womb of his mother, but the destination came and Subhadra got down the chariot and he did not hear how to get out of the Chakravyuha. So a child is awake and alive inside you. So try to hear good things. Don't try to watch all those violent movies and perpetuate violence. It must be impacting a child when, if you watch all those, there are some channels in the Netflix and all which are devoted to violent movies and all those explosive things going on.
Yes.
It's people are very fond of those channels, especially young children. They're very fond of those things, you know, people being murdered, clobbered to death and shootings happening. I mean, I think it's not healthy. I mean, some of the older families, as Dr. Prasanna said, make the woman read Ramayana.
Yes.
Yeah.
Scripture. Yes.
At least a page from the Ramayana every day, or listen to some soothing bhajans every day. Yeah, it's so healthy and so nice. Every woman may not be able to sing herself, and with a big tummy there, it's difficult to sing also. But listening to music and healthy music and soothing music, I'm sure it's going to be very beneficial.
Self-talk also, you know, Dr. Vasundhara, Dr. Prasanna, and Lakshmi, I think self-talk, you know, Albert Einstein said there are the two kinds of people in this world. One who thinks that the whole world is, you know, very progressive, cooperating, you know, it's a wonderful place to be in. And the other is the other type. And because somebody asked him what kinds of people do you see. So I think that is also self-talk, what you are telling yourself about whatever is happening in your life right now. You know, the whole conversation that you're having with yourself on a daily basis, the thoughts that you're having. I think that if it is positive, I'm sure it would also, you know, just work for the good of the mother and the child more. So yeah, these things seem small, but they have very big impact. I'm sure they have a very big impact. If we could move to, do you want to highlight the precautions, Dr. Vasundhara, that you have to take just before and after childbirth? Because I think it doesn't just end with delivering the baby. You do have to take precautions till you are somewhat strong and the baby is safe to, you know, just be then taken.
There will be a big list of precautions. Yeah, but I would start with diet and moderate exercise. Yeah, watch your diet. Don't eat too much, as Dr. Prasanna said. Last few weeks of pregnancy, watch your eat small, frequent meals and of medium or low calorie foods and not high sugary foods in the last few weeks, because that's the time when the baby tends to get fat. Yesterday, we have delivered a baby who is 4 kilos and 200 grams in weight. It's a huge baby, like a baby who is already 1.5 months old.
Yeah.
So big. Yeah, chubby cheeks and all that. So please don't make babies like that.
Yeah.
Good weight for a baby is about 2.8 to 3 kilos. Easy to deliver. Good for the mother. Yeah. And these, mind you, and these babies who are born heavy, they are so used to a very sugary environment, yeah, that they come out and they start demanding feeds right within few minutes of their birth. And these children grow up and right in their second or third year of life, they want to eat only cakes and potato chips and drink Coca-Cola. Sugar.
I do know of such children, yes.
Yes, very, very unhealthy. But then the children get very upset if you don't give them. That is because they are being programmed right from their time in the mother's womb to eat all sugary things. Their insulin levels are very high. Yeah, and they are also very obese. These children also tend to get very obese. All they do is sit and eat and watch television. Eat, watch television or play video games.
Yeah. So I don't know families who say that our children just refuse normal food. You know, just the normal lunch and dinner that is happening. No, they do want exactly what you said, just the snacks, just the soft drinks, just that, chocolates, that's it. Yes. So we have programmed them. We are the ones who are at fault because we have programmed them.
Yeah. And culturally, in every part of India, we have a lot of precautions to be taken after the childbirth. Yeah. For instance, a simple thing now, because thanks to COVID, isolation and quarantine have become very common words. Even my maid and my cook knows what is isolation and what is quarantine and the difference between isolation and quarantine. Yes, but our forefathers, our grandmothers, our grandparents knew what is isolation. And a delivered woman who has just delivered should be isolated, you know, screened from people who have infections for the first 10 days of life. A simple precaution of not going inside a woman's room, yeah, directly with your footwear on, leave your footwear out, wash your hands and feet, and then go. I mean, is it not what we are all doing now because of COVID?
Yes.
Yeah. So that isolation was important. So those are the things. There was a set of foods which to be eaten, which to be not to be eaten. So I think there was a lot of wisdom. And although they had no scientific evidence, it was not evidence-based. But I think the generations of experience is the evidence what they had. And that should be honored, that should be brought back. And because they are all full of generations of wisdom, it doesn't mean that should be brushed away. Yeah, but yes, certain things are not good. I know certain families where the parents of the girl are supposed to give her a can of 5 kilos of ghee at the time of 10th day of the childbirth. And
very difficult to come back to normal weight after that.
And the girl has to finish that 5 kg of ghee in that 1.5 months.
Oh yes.
So these are bad.
It's very difficult.
Yeah.
That much of ghee was required for if you were practicing in olden days with a lot of walking, with no mixies and no help, a lot of physical work, going to the well and getting your water, bringing, that was good. But not anymore. We don't do all that now in the cities or even in villages.
No, we don't.
Yeah. So certain things were not good, but all those old practices were really good. And I should say that they should not be brushed away. Give respect which is due to them and please follow that. And this will happen only when there are elders in the family.
Elders in the family.
Yes.
Yes. Someone to share the traditions. Someone to share all those recipes, someone to share how, you know, how do you massage a baby properly? How do you, you know, all those small things, just do it right. And yes, you will definitely have a normal, healthy.
There is scientific evidence that babies who are given a good massage with a warm oil sleep well. There is scientific evidence. They are happier babies.
Yeah.
It is very well known. People have proven with scientific evidence that they sleep longer.
Yeah.
Better quality sleep.
I also read a paper, you know, where they talk about babies who are, you know, how much they are touched and held in the hands and how much they are hugged and, you know, how they grow differently, like physical touch of the mother and the family, how it has a direct correlation to the way the baby is growing. You know, why this study was done was that because a lot of the mothers may not have as much, you know, full day time to be with the baby. So the study was done to see the impact. And which brings me to the next question about working mothers, crashes. When do you think it is okay for the mother to, sort of spend a few hours away from the baby working? Even otherwise, even if you're not having a career outside, you are working in the house. You are away from the baby, you're not attached to the baby 24 hours. But what is, in your experience, an okay time for a mother, say she's working in an office, to leave a baby in a creche? Because I have friends who run creches, and they even take care of babies who are a month old. So is there anything from your experience which tells you that no, at this much time the mother must be with the baby no matter what?
Well,
And then,
early touch. We are doing a scientific study in our own hospital. The Department of Neonatology, along with us, we are having 2 studies going on skin-to-skin contact between the mothers and the babies, and its impact on breastfeeding by the mother. Yeah, the 50s and 60s babies, suddenly there was a wave of excess medicalization, and as soon as the baby was born, he or she was swaddled in clothes and taken away from the mother to be cared by the child specialist, pediatrician, neonatologist.
wow.
Yeah, 50s and 60s, probably we were all done like that. Taken away from our mothers, not allowed to be handled by the mother, because mother is tired, mother is not well, and mother needs all the rest, and the baby should be separated from the mother. Baby should be given all those fancy formula feeds for the first 3-4 days of life, and then you'd give the baby to the mother slowly. By that time, you lost precious time of bonding.
Yeah.
So now we have a project going on, a research project going on in our hospital, where we give the baby directly onto the mother's chest as soon as the baby is born. As soon as the cord is cut by the father, we give the baby onto the mother's chest. Yeah, and also later, the mother carries the baby on the chest directly. That is called as the kangaroo mother care.
Yeah.
Because the kangaroos, they carry the babies in their pouches.
Yes. Yes.
So like that, we do that for the babies, and that's called the KMC, or kangaroo mother care. And let me tell you, a kangaroo mother care can substitute for a incubator.
I see.
Even a premature baby who is born of less of weight or early, if given kangaroo mother care, would not require an incubator. So it's, and the baby is swaddled in clothes along with the mother on the mother's chest. So these kind of experiments are going on, and they're all giving us positive results. So the babies should not be separated from the mothers, and also the baby's response. We have another study going on where we need the babies to give us some blood sample for some tests like jaundice or sugar. And these babies, the babies who were on their mother's chest tolerated the procedure better than babies who were in the crib, and we gave a prick and we took a blood sample. So these kind of studies, scientific studies, are going on in our own hospital, and it is proving that skin to skin touch is invaluable. It increases the confidence of the mother, it increases the milk output of the mother, and that way helps in the health of the baby in general, which will last with him till a long time. So a well-fed, a baby who is completely fed with the mother's milk grows up to be a healthy child with good immunity.
Yeah, that's a very powerful insight. And because you also, are on the academic side, and you are, attached to an institution, a medical institution, as well as a hospital, it is so important. I mean, you get these insights and you use them in your practice, and then your practice feeds you with more information, and then you can, I think that's brilliant to be able to do both these things. You were talking about breastfeeding. Ms. Lakshmi, I would like to ask you, breastfeeding is looked upon as extremely vital. But like we have been discussing, sometimes women may not be able to breastfeed, or they can have other ways of helping the baby. So what is your entire experience about breastfeeding? How long should it continue? what impact does it have if the mother is not able to?
Actually, exclusive breast mother should feed till 6 months. So exclusive breastfeeding is better. So we have a lot of like children with exclusive breastfeeding. They have like good growth and development than on the formula feeds. Like formula feed, a lot of infections can come. So breastfeeding, and we always encourage the mother. We counsel the mother. So if mother takes a proper like high protein and all the sources of nutrients and with lot of liquids, they can give so always in our institute we counsel the mothers about the breastfeeding, and in certain cases where if there are any problems with that, few children like for time being fed on the formula, but again encourage them to feed the children. Even the same thing, like if the children are habituated like every hourly and second hourly, they also suck well. It's like for few people, it's a habit as well. And mother also should take a nutritious diet. Then like it is always like a breastfed child will have a better immunity compared to formula feed.
Yes. And there are so many studies around the world.
Yeah, there are so many studies.
And I think corporates also, take care. They provide young mothers with separate rooms for breastfeeding and creches, so that for the few hours they're working, they can leave the child. But I'm just saying that these things are very important, and a mother must not let go of these very vital things. The thing to talk about is, what is the right time to get back to work, Dr. Prasanna? What is you yourself are a working doctor. So what is the right time to get back to work after having a baby? And does it depend on each mother's physical condition requirement?
Yeah, there is no fixed time as such, but usually the postpartum period, it lasts for about 6 weeks. And nowadays, according to ACOG guidelines, we are calling the postpartum period to be extended till 12 weeks. So in our tradition, actually, when the woman gives birth, she goes to her mother's place, she gives birth, and she stays there for 3 months.
Yes.
So in a way, that 12 weeks tradition. So usually it is 6 weeks. Within 6 weeks, a woman can get back to her work if she had a normal pregnancy, a normal delivery, and she doesn't have any complications. Then maybe she can get back to in 6 weeks. But the thing she has to take care of is where she is going to leave her baby, for how many hours she is going to leave, and how she is going to breastfeed. Because breast milk is important. Whether she can pump out the milk, store the milk, where to keep her shifts, all these things she has to take care of. So depending on that, we can advise the woman like when she can get back to work. Like if it's a part-time job, if she can arrange for a part-time job, or if she can take like in the workplace, if she has a facility where she can go and breastfeed the baby and come, maybe in 6 weeks she can join back. And if it is if she has long hours of shifts, then maybe 12 weeks. That will be better.
Yeah. No, so I do think, everything that you are saying leads to if you do not have very good advice coming from within the family itself, it is a very good idea to have these conversations with your doctors, because really for you, all of you, this is something you're saying day in and day out, and you can just suggest without thinking too much also, because you just know instinctively what would help a young mother. Especially if it's your first pregnancy and you have questions about everything and you're not sure about anything, it is better to have these conversations.
You should have somebody who is going to help, who is going to change the diaper, who is going to feed the baby. All these things come into the mother's thinking. Like when she wants to leave the child, then she should have some help. Without help, then it is very difficult for her to leave the child.
Yes.
So family support is very much important, and maybe they also need help from her partner, father, and he has to take care of the child when she is not available.
Absolutely. Like I do know, I have a friend who, in the one thing she was not prepared for at all is the baby sitting up all night and being cranky. And she said, Deepal, I'm just dying to have sleep. Just if I can have 4 or 5 hours of peace at sleep, I would be so thankful. So, I mean, you never really know. And if you really do need support, you do need someone to stand by for you, so that you can also
like traditionally we have a tradition, like when our grandparents say, whenever the baby sleeps, they ask the mother also to sleep.
yes,
Because that is the best way to follow.
yes.
Because whenever the baby is sleeping, the mother also should sleep. That is a tradition in the postpartum period. Because that is the time she gets to rest and she gets the time to sleep.
Yeah, totally. Yes.
Yeah.
That is so aligned to the cause of both.
Yeah.
Both of them can take it. True.
Now the government of India has made 6 months of maternity leave for all the organizations. Yeah. But I advise young mothers not to postpone your maternity leave until the last day of your pregnancy. Please take few weeks off even before you deliver.
Yes.
Say 3 to 4 weeks off before you deliver. Take adequate rest at home. So that your nutrition can be managed, your little walks can be managed, because you are not under pressure to eat whatever is available in front of you because you are working. You can, prepare mentally yourself. Birth preparedness and complication readiness is a very important aspect. Maybe you can attend some parent craft classes if they're available anywhere. Maybe you can attend some Lamaze classes if they're available. Lamaze is a specialized exercise schedule in pregnancy. That helps for a normal vaginal delivery. So they can attend that. So most of the
parent craft, what do you mean, Dr. Vasundhara?
Sorry?
What is parent craft?
Parent craft is, as you know, most of the couples don't know how a baby is to be fed or if it is to be burped, taking care of the after the birth. So they actually make the fathers change diapers and stuff like that on dolls in the parent craft classes. They are being held in many hospitals in our city. So they should be done. Most of the young girls, they want to work until their last day of delivery and then go on a 6 months leave. So this is not to be encouraged. There is some sanity in giving such a long leave, a paid leave for a woman. And mind you, these leaves are given by the government of India, even to women who take children for adoption, who have babies by IVF, surrogacy also. So all these are considered very important for a bonding between the mother and the child. So please do not postpone your maternity leave until your last day of your pregnancy. So 3 to 4 weeks before delivery and about 5 months after delivery should be a good period, I feel.
Yes, that's the idea.
The child is able to sit. The child can take some semi-solid food, either prepared at home or some kind of ready-made semi-solid food which is available, and the child is able to sit independently without support. That is the time I think a woman can get back to work, because that is the time when someone else also can give a feed to the baby.
Yes.
So these are all the things that's how it is so scientifically designed to have 6 months of paid leave for childbirth, maternity leave.
No, this is such a
pregnant women also, it helps a lot.
Yes, of course. No, I think every single point that was raised is vital, and bringing another life into this world should be a very enthralling experience, full of joy, and full of, it should be a marker for your life that you did this, and with advice and help from, experienced doctors and dietitians like all of you, who are well versed with all our traditional knowledge that India has. And India has a very rich traditional knowledge in this space, along with the modern research, the modern medical, tools that we have. I think all these things put together would give any woman who seeks help, like you said, I think Dr. Lakshmi said, before the pregnancy, you should start seeking help so that your body is in a great shape, to conceive and have the baby, and right through the pregnancy, take advice. So you are in good health, your child comes in good health, and your family is ready for this experience, and it becomes a very memorable, joyous journey. So I cannot thank you enough, Dr. Vasundhara, Dr. Prasanna, Ms. Lakshmi, for all your inputs. They were so important and vital, and more importantly, they were clear. There's an uncluttering of knowledge which happens when people like you share your wisdom, and because there is endless information available today on the internet, and that would only confuse a young mother more. So it is so vital to hear people who are rooted in all the things that India traditionally also has to offer, and modern medical science together.
I would like to say one thing, like
Yes.
initially we used to counsel the patient. Now we are actually clarifying the doubts, whatever they have searched in the Google. It's like it is taking a little bit time for them to tell about the actual things.
Yeah, I actually find this very common also, because like I said, we've done more than 100 webinars with super specialists across the country in every stream, and invariably all the doctors today have a separate job, literally, of demystifying all the things that the patient has read. And so much confusion they have about the side effect of this and that and the other, and because they've read so much all over the place. So yes, I know, I'm very familiar with this, and that is why it is very important to go back to experience.
Yes.
And the entire advice that you get should be rooted in experience from people who have been in this day in and day out, which is why we hold these panels. So I'm extremely thankful to all of you, and wishing you a fantastic Mother's Day ahead. And really, we would like to have you back soon on another topic to share some more of your wisdom. Thank you. Thank you so much.
Thank you so much. Have a nice Mother's Day tomorrow.
Thank you.
And for the present mothers and the future mothers also.
Present mothers and future
Mothers to be also. Thank you so much.
Yes.
Take care.
Thank you and have a happy Mother's Day.
Thank you.
Bye.
You too.
Happy Mother's
Bye-bye. Bye-bye.